Hello, everybody. Welcome to the next episode of the Psych Crusader. So, thanks for tuning in. Um, like I said, this is a safe place. You're able to post on here, and there will be no judgment passed for those of you who do jump in on here on the live, or if you watch the replay, that's fine as well. I do regularly check the comments as people do jump on there and ask questions. Um, so for clarity, I'm not a doctor. I do have a background in this field, but I'm just doing this just for information, just providing information so people can maybe better understand what's happening. So today's episode is going to be about bipolar disorder. And this is one that resonates with me. Growing up, I didn't realize until I was in my adult years, in my 20s, early 20s, that this was something that I had and that I struggled with, and I didn't understand why I was struggling. And we'll get into those things, and I'll share some of my personal stories about this. So bipolar disorder it used to be called manic depression disorder, and now it's bipolar disorders because they figured out there's two different sides of it. It causes extreme mood swings. I mean, and I can tell you they are extreme. You're all over the place. You'll have emotional highs, and those are known as mania or hypomania. It just depends on what the high is. The lows are known as depression. So this bipolar disorder is not just something you can walk into a psychiatrist's office and just get an easy diagnosis. There are so many working parts, and there are things that disguise it that you have to be your psychiatrist has to know what they're doing to get this right. Because there's so many misdiagnoses out there, or the bipolar disorder is masked by something else, like maybe like clinical depression or things like that, to where you're only exerting that one side of the pole, bipolar. Or you could be exerting too much of the opposite side of the pole. So you could be diagnosed with more of an ADHD kind of thing. So there's different ways to look at this, and it's going to be difficult sometimes to really like dial that in, especially when you as a person you're experiencing this and you don't know how to properly like get all the information out to your psychiatrist. So we'll go into the symptoms, and I know that so there's basically several symptoms. So you have like a bipolar 1 disorder, and the what that is described as, where you have at least one manic episode that could come before or after your hypomanic or manic issue. So manic is more severe than hypomanic, and we're going to get into those definitions here in a little bit, but just so you guys can follow along, manic is more severe than hypomanic. Some of these cases with the bipolar 1 disorder, the mania may cause you to have a break from reality, not like a vacation break, but it's more of a like you cracked, like you mentally cracked, and you're not living in the real world anymore. You're on generally, and I can explain this, I've been through this several times, but you're in like a Superman world. And so when this happens, when you have that break, it's called psychosis. And I know that term is thrown around a little bit, but that's when you have a mental break, it's called psychosis. And we'll talk more about those things, and we'll give some examples, and hopefully this information may help someone better identify their issues. So then you go into the bipolar 2 disorder, and that's a little bit different. And it's if you have at least one major depressive episode. So the first one was about being manic. This one is about being depressed. But you also have to have at least one hypomanic episode, so a light outbursts of, kind of thing. We'll define those here in a little bit. But you also you can't have had a manic episode. So you're not to that point where you're to the verge of crashing out. So there's also the next one is cyclothymia. And that's where you've had like 2 years or 1 year for youth, for anyone under the age of 18. And that's many years of having like ongoing hypomania symptoms. And that leads into like depression. So if you've had those types of scenarios where you have a couple of those where and that's where we can get clinical depression mistaken for bipolar disorder, because you'll have this type of situation, the cyclothymia, and it kind of acts the same. The symptoms generally are less severe than a major depression. So it's like the initial stages of clinical depression, where you start to have like a couple days in a row where you're just like, man, I'm just not feeling it. I don't want to do anything. I don't care. I just want to go through the motions and be a zombie. So you're not to that point where you've had that extended period of time where it's digging deeper and you're starting to have some really negative thought processes start. So it's kind of a mild depression. So there's also other types, and these types include bipolar and related disorder caused by certain drugs or alcohol. So drugs and alcohol can contribute to the enhancement of your bipolar situation. Or it could be due to a medical condition. And the examples once again, for those of you who don't know, the Mayo Clinic is my source. Everybody knows about the Mayo Clinic. So that's what I use, because it's easy to fact check and go into research these things. So that way, if you don't retain anything I say, you can just go to the Mayo Clinic and look up their recommendations. So the conditions that apply to certain types of bipolar disorder. So you have the Cushing's disease and like multiple sclerosis and stroke can all be kind of wrapped in. You can have those effects from bipolar disorder. I mean, obviously, with the stroke, like if you're going through that mania, your blood pressure is going to go up and you could stroke out. So those are things that, as you get older and you're still dealing with these things, those are things that can happen. Not saying your younger years it can't happen, but generally in your older years. Basically, to sum up bipolar disorder, you can start to appear to other people as having like unpredictable behavior. You're up, you're down, you're up, you're down, you're up, you're down. And people can't gauge, they don't know how to deal with you. They don't know how to communicate with you, because they don't know, is it going to be the wrong day to talk to this guy? Or is it going to be the right day to talk to this guy? I don't know what his levels are. So I think it's important that, you really, really need to take a deep look at yourself, because if you have people around you that don't know how to take you, then you're going to have social issues that could lead to social anxiety. It could lead to all kinds of other issues that could pop up. So the bipolar disorder definitely can give you a sense of, you end up having multiple diagnoses. And that's when, if you don't treat these things, it's going to get more expensive. You're going to have more issues. If you're not treating them, bipolar disorder is a very severe condition. I don't want to say severe, but if it's left untreated, it's an escalating thing where one day you're just snapping, the next day you're depressed. And so you really want to get treatment, at least see your psychiatrist, and come up with a game plan for treatment. That's going to be half the battle, and it's a battle worth fighting, because once you have bipolar disorder, it's never going to go away. It's there. So you either have to educate yourself and create a plan, or you're going to go through a lot of probably legal issues. So we're going to talk about the mania and hypomania and kind of define those, so that way we have a better understanding for how those are going to work. They're different. Obviously, we kind of just vaguely touched on it, but they have some of the same symptoms. Mania is more severe, like we said. It causes more noticeable problems at work, school, social activities because you're just edgy. You're going to be edgy when you're in your if you're into the mania stage of it, or even the hypomania. You're going to be edgy. Your blood's going to be flowing, and you're kind of just sitting around like waiting on an excuse to act out. And that's a problem that I always had. Was I knew I was feeling a certain type of way, but I wasn't educated enough to understand what was going on. So I would end up just going, somebody please trigger me. Somebody trigger me so I can get this out. And then it would happen, and then I would be in trouble for something. So it's something that we need to generally, if everybody experiences the bipolar like I did, then you're gonna feel it coming. You're gonna know. You're gonna wake up and you're gonna know. And even on the depression side, I'll wake up and I'll know like what kind of day it's gonna be. Uh am I gonna be a manic or a mania, or am I gonna be depressed? What am I gonna be today? And I can pretty much tell as soon as I wake up what kind of day it's going to be. And so that allows me. I'm lucky I have an hour drive to work every day, so it gives me the opportunity to change my direction of thought. Where in my younger years I didn't always have that opportunity. One, because I wasn't educated enough on what was going on with me, and for two, um, I didn't have enough time to myself. I had a lot of young kids at that time, so it was like there's no time to relax. You have to raise kids, you have to go to work, you have to do all these things, try to be a husband, try to do this, try to do that, and it's difficult, and try to balance your own mental disorder as well. So it's a tough one. um Mania, it causes the break from reality, which is psychosis, so we've already covered that. But that's when you get into psychosis, things become very, very serious, and they become very, very real, I'm sorry. And sometimes that psychosis is going to require you to be in the hospital. You're going to have to go in a place where you can't hurt yourself and you can't hurt anyone else, and just write it out. There's no And I want to say this. I've got family members that have had to go this route. And I want to say that there's no shame. There's no shame in doing that. You're better serving yourself and the people around you if you go take those 72 hours and you just write it out. You're going to come out feeling a lot better, and you didn't hurt anybody or yourself. So I can't stress how serious that situation is. Um, so in order to have a manic or a hypomanic situation, you have to have three or more symptoms. And they've defined them. The Mayo Clinic has defined those symptoms as one, you're more active, energetic, and you get agitated more than normal. So that's when you're just amped up, and like you're just kind of, a lot of people probably think you're on meth or coke or something. That's how generally I get real amped up, and I'm just bouncing off the walls. The second one is you have a feeling of like a distorted sense of well-being, like you're too self-confident. I can't really relate to that one. I have never really felt that, but maybe some of you out there have. Number three is needing more sleep than usual. For me, I need more sleep, but I only sleep like maybe 5 hours a night. So I always need more sleep. It doesn't really matter what my condition is. Um, the next one is number four, being unusually talkative and talking fast. Um, that can happen. I've seen people where they're so amped up that they're just blah, 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 and they just don't stop. So that's a situation. And so I mean, it's not necessarily when you hear somebody do that, you shouldn't like throw up the panic flag, but you definitely should pay attention to the other situations going on that go with that. Number 5 is having racing thoughts or jumping quickly from one topic to another. I have racing thoughts. My brain never stops moving. So for when I started writing books and then I started podcasting, this was the best thing for me, therapeutic wise, because I give my brain an excuse to utilize those racing thoughts for something that I can do that's good for people. Um, as opposed to having my last wife leave, and then I just sit around and I sit and manifest in those racing thoughts of those emotions, and then building up the manic part of the bipolar. All that would have been triggering had I not had this as a therapy kind of thing for me. So it worked out really well for me. For those of you who have watched my show, I don't take meds. Meds is not my thing. I believe in other methods more holistically, or in meditation, or in prayer, or just facing your own self. I think facing your own self is a big one. Like I said in my previous podcast, I had an uncle that he went through a lot of things when he was in Vietnam, and he told me one time, he said, I didn't realize I was crazy until I looked at myself in the mirror and saw I was crazy. And that kind of like opened my eyes to a lot of things, like how often do we really look at ourselves? And so I try to make a habit, more often than not, to really take a look at myself and say, what type of person are you today? And plus, it allows me to it's like take the 30 seconds and process it. Like, am I this or that, or this or that today? How am I going to be affected throughout the course of the day? Is there anything I can do throughout the course of the day to curtail negative behavior? So I really try to kind of diagnose myself, or to take an early leash over my issues. And if I can kind of see myself and go, okay, today's gonna be a rough day. Let me get a leash on that today. And it works most of the time. I mean, I have my moments, but 99.9% of the time I'm able to control it. So number 6, easy to distract. Yeah, I mean, that could happen. I'm not that type of person. I don't get I'm pretty laser focused when I get into something. 7, making poor decisions. Like you could go on like shopping sprees, or do like sexually deviant things, take risk, or like even like a foolish investment, gamble some money away. Like you tend to get carefree, and that's not always a good thing when your mindset is not protecting you and you're just reacting. You tend to make more mistakes. So we also have the major depressive episode. So this all goes with having bipolar. Like I said, it's not an easy thing where you just walk into the psychiatrist's office and you go, well, I think I'm bipolar. There's a lot of things to look at. And so we get into those things. Major depressive episode, it includes symptoms that are severe enough to cause you to have a hard time doing day-to-day activities. I went through that about 2 years ago, and I had some news that came my way that didn't go my way, and I didn't know what to do. So I got really, really depressed, and I was alone at the same time. I'm 600 miles away from my family. I didn't have a wife my wife was gone. So I was down here by myself trying to deal with these issues on my own. And it was very difficult to kind of pull myself out of that. I almost lost my job. There were so many things that were going on, and I had to basically wake myself up and go, you're destroying yourself. And it's time to walk through this and start making progress in a more positive light, because you can't keep doing I couldn't keep doing that. That was not going to work for me. And so you can have these day-to-day problems, and that could be a major depressive issue which is basically, clinical depression. You're at that point. These activities include going to work or school, as well as taking part in school activities and getting along with others. So yeah, that's basically me. I don't want to talk to nobody. I don't want to hear nothing. I don't want to talk to nobody. I don't want to hear nobody's problems. I didn't want to do nothing. I just would sit around and go, somebody help me solve my problem for me once. And so I struggled with that because trying to solve these major problems that are going on inside my head by myself is difficult when you don't have that person to, sit down and do that outlet with. And, I like, therapy's fine and everything. I could have done that. I thought, I gotta work this out. I just sit down and work it out. And I did okay. So when we look at, the major depressive, episode, there's, you have to have 5 or more of these things. So number 1 is having a depressed mood. Like if you're just depressed, you know what depressed feels like. Just about 100% of the population knows what depression feels like. You can feel sad, empty, hopeless, or tearful. Children and teens who are depressed can seem irritable, angry, or hostile because they deal with these emotions a little bit different than we do because they don't fully understand them. So they're going to react in other ways. So pay attention if you have kids that are going through things like this and just monitor their behaviors. Number 2, having a marked loss of interest as feeling no pleasure in all or most activities where you're doing like I go to the gym every day. So during the times when I get depressed, when I'm going through this type of situation, what happens is like I go to the gym and I'm not happy. I'm not happy when I'm there. I'm just going through the motions and I get nothing out of it and I don't care. So that's a situation that is comparable for me. Number 3, losing a lot of weight when not dieting or overeating and gaining weight. When children don't gain weight as expected, this can be a sign of depression. So you have to know the difference between is your kid hitting a growth spurt or not. And so it's a little bit more tricky with kids. You just got to pay attention to kids. For me, I don't eat. When I'm depressed, I don't eat. I lost like 25 pounds in like a very short amount of time because I just didn't eat and I was too depressed. I didn't have an appetite, didn't do nothing. You could sleep little or too much. It just depends on, it's just like you either eat or you don't eat. So it just depends on how your mind and your body reacts to the depression. Number 5, feeling restless or acting slower than usual. So that's another one. You can either do it this way or this way. So I get restless. I don't want to like stay calm. I want to move around because I feed off of the adrenaline of it. And so my blood will tend to pump a lot more, and which is something that I'm self-creating, but I have to be careful because as I get older, it could cause me to stroke out. So this is something that I have to, try to maintain and keep myself from getting to that point. Where in my younger days, I was like, I'm in the bar and I'm looking for somebody. So, you don't want to be like that. We'll get into some of the bad decisions I made here in a little bit. Number 6, being very tired or losing energy. So I had that problem. I was restless, but I was exhausted. And I didn't feel like doing anything except being restless and letting those thoughts just go through my head over and over and over again. And that's what made me tired, was I was exhausting my mind. So that can happen. Number 7, feeling worthless, feeling too guilty, or feeling guilty when it's not necessary. I went through all that, all 3 of them. You're either worthless, you're guilty, or you're guilty when you're not even guilty. You just start blaming yourself for everything, and that part of it, when you get into that depression, into like the hypomanic part, where it's more mild and you're slipping into this depression. that can cause major depressive episodes if you don't self-identify that this is going on. So always know what you're looking at. Number 9, thinking about planning or attempting suicide. Now this is very common. I don't want to say it's very common, but amongst people with bipolar disorder, it is a thought. It is a thought that crosses people's minds. So I'm going to urge you that you have to be self-aware. If you start feeling like you're like sitting there weighing the options and going through, is there anything left for me here? Should I just be done? And when you start having those thoughts, I want to urge you all to please reach out to someone, anybody, anybody on my platforms. If you are feeling this way, you can reach out to me and I will do my best to help you. I will also, in the comments after the podcast, I will put the suicide crisis hotline up there like I do on most of my episodes. All you have to do is look in the comments. It's right there. It's very easy to utilize the suicide prevention hotline now. I urge you all to use it. Most mental health facilities have a 24-hour crisis line. I urge you all to reach out and find crisis lines. If when you're at that point where you're like, I don't know what to do, and it's 11 o'clock at night and it's on a Saturday night, those places don't close. You can call them at any time. I urge you all to utilize those crisis lines. And they are there and they're free. Just use them. So let's get into treatment. How are we going to treat bipolar disorder? So there's ways, there's treatment, but like I said, bipolar disorder is not going to go away. You have it. When you have it, when you've brought that out of your receptors and out of your brain, it's there. It's not going to go away. There's no cure for it. There's just ways to kind of make it kind of soft. You soften it up. That's the best way I can describe it. So the first thing, what you want to do is you want to get a physical examination. So when I first found out I had it, so I'll just tell the story. So I was I thought I had an authority problem. But then I realized I was reacting to things. So then I realized that, maybe I have a something else. It's not just an authority problem. I react when I'm angry, I react to it. And so I was working for a sheriff's office at that time. And the sheriff, I had an outburst at work, and it didn't involve being a brutality towards anyone. I was just mad and voicing my opinions, and it was a little animated. So my sheriff told me, he said, look, you're gonna have to go get treated. You have to figure out what's going on and get this taken care of. I can't have you out doing anything like this. And so I did, and I went to therapy. And so the first thing that they did was they ordered me to go to the hospital, and I took this exam. They wanted to see how my brain reacted to things. So they put me in this super, super dark room, and they hooked all these things up all over the place, and they put these, blinders on me. And then they kept flashing a strobe light. So what they were doing is they were looking at how my brain reacted to stimulus. And that helped them kind of narrow down what was going on. And, I never did look and see what my results of that were, but it ended up me getting diagnosed with bipolar disorder and the impulse disorder. And then they gave me, some psychotropes. And then, I took them for a while, and everything was cool for a while until I stopped taking them. So you want to get a physical examination, because sometimes, and God forbid this ever happens to anybody, but sometimes they'll find that you have a tumor in your brain that's causing you to behave like that. So if you have something going on in your brain and you don't realize it, it's always good to go get an exam and get these things looked at, because it may not be a mental condition. It could be a physical condition that is treatable. I've seen so many stories where they take the tumor out and then they're fine. So that could be the situation, but it's always good to check anyway, just to make sure. Then after that, you want to get your mental health assessment. Sit down with your psychiatrist or your counselor, whoever's going to assess you, and lay it all out there. Don't hold back. You lay it all out there. That's what therapy's for. We get into therapy and we get too reserved. Go in there and lay that all out there for your therapist. Don't let them miss anything. Don't keep nothing from them. Just throw it out there. Say, here's what's going on. Here's my thought process. And let's make a plan. I don't want to think like this anymore. So you have that. I think it's important sometimes to do a mood chart. When I start to feel like I'm starting to get unstable, I will chart the mood and just like, here's what today was, and here's something triggered me, and this is what it was. That way I can look at my behavior and go, okay, am I up or down? Am I flatlined in the up, or am I flatlined in the down? Like, what part of the stage of bipolar disorder am I at? And so I can kind of, chart myself and try to figure out how to fix it. Now, children with bipolar disorder. So this is a whole other ball game here. And because we'll get into it right now. So although children and teenagers with bipolar disorder are diagnosed with bipolar disorder based on the same criteria as used for adults. So they look at kids with bipolar disorder the same way they look at adults. However, the symptoms in children and teens often have different patterns. Okay. These patterns may not fit neatly into a diagnostic category. So what they're saying, what the Mayo Clinic is saying there, is that kids react different to things. Their outburst could look like something else. Generally, once you hit a certain age, your outbursts become the same. When you're a kid, you're going through this emotion, this social adjustment, this social adjustment. So you're all over the place, and you don't really, you're trying to figure out what the proper reaction is. And so you're going to see a lot of different ways of reacting when children are dealing with the bipolar disorder. Most of the time, it's going to be extreme. It's going to be like super extra. So just be prepared for that if you have kids that are going through bipolar disorder or that you suspect are. Children who have bipolar disorder are often diagnosed with other mental health conditions such as ADHD or behavioral problems. So this is what we're talking about when I said that there's multiple, you can end up being multiple diagnosed, where you get bipolar disorder, but ADHD is on top of it, which enhances your bipolar disorder, which turns around and enhances your ADHD. So you got two things working together, and it's like giving yourself, they're giving each other crack all day. And so that's a problem that, you really, 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 I can't stress it enough, really, really need to sit down with your psychiatrist and let them know that this is what's happening. I've got all this going on. This can complicate the diagnosis. It's going to make it harder to really zero in on the diagnosis. That's why the psychiatrist is going to depend on you to give them the proper, symptoms. Like, you have to be honest. You're not going to be able to do it without being honest. So these children may need to see a child psychiatrist when they start to emit these like kind of crazy patterns of things that they're going to experience with the disorder. So you have to pay attention. So treatment wise, we'll talk about the treatment, and let me scroll down on my outline. So treatment is best guided by a medical doctor, obviously. So if you're going to seek treatment, whether it's through medications, whether you agree with your psychiatrist to medicate, or whether you just do, just general therapy or more enhanced therapy, you want to be honest with that doctor. Let the doctor do what the doctor's supposed to do. They make a lot of money. They went to school for a long time to be able to help you with these situations. Just let them help you. So you want to be guided by a doctor who diagnoses and treats mental health conditions, who's skilled in treating bipolar disorder. So you generally want to try to find a bipolar specialist if there are some in your area. That's not always the case. Sometimes you have to just take with what you get. Your care team also may include a psychologist, social worker, or psychiatric nurse. Maybe sometimes. I mean, it just depends on the situation. Bipolar disorder is a lifelong condition with treatment directed to manage symptoms. So you're not going to be cured at the end of this. You're just treating the symptoms that are always going to be. They're always susceptible to come back. I didn't want to say that they're always going to be there, but they're always going to be susceptible to return. As soon as you get off your meds, the chemical makeup of your body changes again, and then you're going to react to it. And you're probably going to go back to the behavior that caused you to take the meds in the first place. So I would just say once you get on the meds, if you can't self cope and have your own warning signs that you can see and understand and be able to stop, then I would highly recommend that you go through the medication process, the therapy process. You want to do those things. So depending upon your needs and whether your therapist believes that how severe it is, treatments could include meds. You're going to start taking meds. You should start taking meds. Once you get this diagnosis, you need to be on meds. Get on them right away. It's going to balance you out. Number two, an ongoing treatment. So you're going to need to take your medicine for the rest of your life. Even when you feel better, don't let that trick you, because as soon as you stop taking your meds, you have a high probability of twacking out again. Or you have minor mood changes that could turn into full-blown mania or depression. And so you have to do it. Like, your body gets used to meds and being on this like even keel throughout the 5, 6, 7 years, and then all of a sudden you stop taking your meds, you're going to go into probably a manic situation because you're not used to it. You're going to go back to those out of balance feelings. Number 3, intensive outpatient programs are a program involving a partial stay in a hospital. These programs provide intensive support and counseling that lasts a few hours per day for several weeks to help you get symptoms under control. Like I said earlier in the show, don't be ashamed of this. It's better that you get the help you need than to do the negative behaviors that I was accustomed to in my early years because I didn't know any better. So do get the help that you need. There's nothing wrong with that. The main treatment for bipolar disorder includes meds and talk therapy, psychotherapy, to control your symptoms. Treatment also may include education and support groups. So we're doing education right now. There are support groups out there for people. I don't mind support groups, but it just depends on what your level of comfortability is when it comes to just throwing your stuff out there with other people. I recommend it. I don't mind it. I like sharing, and I like, maybe somebody helps me, maybe their story helps me, and maybe my story helps them. So I think it's healthy, but it's whatever your cup of tea is. So med wise, so we're going to go through some meds. So that way, when you start, if you have to go through this and you start hearing about meds, and you'll know, this is what this is for, and this is what this is for, because doctors don't tell you shit. Just to keep it real, they don't tell you everything. They just expect you to go be an internet sleuth and figure it out. So you can get mood stabilizers, which controls the manic or hypomanic episodes. So it keeps you from going high, or it keeps you from going too low. It just keeps you right on that even keel where you're able to function. So there are 5 medications that the Mayo Clinic talks about. One is lithium. One's valproic acid. The next one is divalproic sodium, which is Depakote, which is the medications I took at first. And then I realized I was allergic to it, and I had uncontrollable hiccups for like 6 days. I had to go get a shot in my butt to relax my diaphragm. So I don't take Depakote anymore. There's a carbamazepine and Lamo something. I've never heard of Lamo, whatever it is. Lamotrigine must be some new stuff. But so you have the mood stabilizers. The mood stabilizers are very beneficial, especially if you have a tough time like gauging in your own emotions. These things make it almost dummy proof. You're gonna get your doctor's gonna dial you in because it does take a bit of dialing in. Your first round of meds may not be perfect or exact, but go be honest with your physician and allow them to change your dosages, whichever way that you're experiencing the side effects. It's important. You need to do it. So the mood stabilizers are good for you. So the next one is antipsychotics. They can either be used by themselves or they do pair them up with the mood stabilizers because obviously you hear it in the root words, anti and psychotic. We're trying to keep you from being psychotic. So I've been on a few of these. So you have olanzapine, risperidone, which I've been on that, quetiapine, lurasidone, and yeah, there's a couple more, but they're not as pertinent. But risperidone is a very common one that you use for an antipsychotic. It's probably the most used. I've been on those. I know how they feel. Once you get on them, you're just like, see, I was over medicated there for a while and I was like a zombie. Like I didn't want to do nothing. So I just sit on the couch and literally not talk and not blink. I just stare off into nothingness. So then I had to go back to the doctor and they had to dial it down a little bit. And then I was fine. So you do have to, dial these in. You also have antidepressants to manage your depression, generally taken with the, mood stabilizers. They kind of go hand in hand. Mood stabilizer, you're going to be on a mood stabilizer most likely. Antidepressant, antipsychotic combination. So they have one that is kind of like a do-all medication, some new stuff, Symbyax. Number 5, so you have anxiety meds. They're for short-term relief. They're not going to solve your problem for a long period of time, but they're going to give you some relief. And generally they give you benzodiazepine. I've been on that too. It's effective. It does work. So that's basically our entire outline of bipolar disorder, the things that you go through, the medications, the treatments, the definitions. So if you start to think that you may be off a little bit, and it's okay to admit to yourself, like maybe I'm just a little off. Start to log your moods, and you're going to be, it's going to help you out in the long run because you're going to be able to dial your own situation, and you can take your mood book and hand it to your psychiatrist and say, here's what's going on. Can you make sense of that? And generally they're going to look at it and go, okay, I see what's going on. Another one that I want to talk about, and I do this at the end of every show for the most part, but is faith. I recommend prayer, meditation. If you have a tough time talking to other people, talk to God. God will listen. So I highly recommend that you seek out your faith and utilize it. God wants you to reach out to him, and most of the time God's going to come back and he's going to alleviate you. So reach out to in prayer, ask for help. It's okay to ask for help. Reach out to people that could listen. Sometimes a perfect stranger, I know it's not good to talk to strangers, but if it's somebody you just met that you don't really know all that well, sometimes the best person to talk to is somebody who don't know you and they can't pass judgment. They're just listening. So those are all different strategies, different, it just depends on what you're comfortable with. I do a lot of breathing. I do a lot of self-talk. The people who work for me probably think I'm crazy because I self-talk all the time because I can, if I hear myself problem solve something, I can manifest it. So, that's, just use your faith system. So if you're experiencing bipolar disorder or anything, and like I said, I'm going to put I'll put the crisis line, a national crisis line down there in the comments too, but I'll also put the suicide prevention line down. so that way everybody knows where to look. And that is going to be the wrap up of my show. Thanks for tuning in. I am going to start working on bringing in a co-host to do this show with me. For those of you who pay attention, I do have two shows. I have a political show and this one. So I'm just going to bring somebody in just for this type of situation. You know, somebody who has a little bit of a different outlook on things. So everybody be safe out there, and pay attention to your own behaviors. Look at yourself and go, what kind of person am I? And tell the truth. You got to tell the truth to yourself. So that's where step one's at. All right. I will talk to everybody next week.